ultimately, our goal is to screen all of our patients for social determinants. And again, we have a large number of patients. So how are we going to move from this high-touch approach to a lower-touch approach? And our solution was to work with 1Degree, which is our digital platform for social services, and to actually digitize the Prepare tool. This new digital process was really an extension of the work that we already had with 1Degree, and being able to work with 1Degree to send out the Prepare assessment through a text message. And the fact that through a low-touch process, they'll still be able to identify resources for themselves is really, I think, a great innovation. And we're really excited about the spread of this work.
Welcome to the Health Pilots podcast, presented by the Center for Care Innovations. This podcast is about strengthening the health and well-being of historically underinvested communities. Every episode offers new ideas and practical advice that you can apply today.
Hi, everyone. I'm Jessica Ortiz with the Center for Care Innovations. And today we're talking about one of the exciting projects that Northeast Valley Health Corporation has been working on for the past year. And really, they've been dreaming up this solution over the past 5 years. Our hope is that by sharing the highs and lows of this digital health solution, safety net organizations can apply the lessons learned to their own challenges. I'm here with Debra Rosen and Alejandra Mata, member of our Tech Hub Learning Network, which is comprised of 14 tech-forward, California-based community health centers, clinic coalitions, and primary care departments in county health systems that are working to accelerate the adoption of innovative technologies. We partner with our Tech Hub members to vet, pilot, evaluate, and spread innovative digital health solutions serving Medicaid markets and historically underinvested communities. And we are really excited to bring you this story today. Debra, we can start with you. Can you introduce yourself to the listeners and share a little bit about your organization?
Sure, happy to. Thank you, Jessica. My name is Debbie Rosen, and I work for Northeast Valley Health Corporation. We're a federally qualified health center in the north area of Los Angeles County. We're pretty large, 17 licensed health centers serving over 80,000 patients. And I have been working at Northeast Valley for 34 years. So my title is Director of Quality, Health Equity, and Innovation at Northeast Valley Health Corporation.
Great. Welcome, Deb. And Alejandra?
Hello, everyone. My name is Alejandra Mata. I am the Associate Director of Health Equity at Northeast Valley Health Corporation. Just some large programs that I oversee at Northeast Valley would be our chronic disease programs, our programs related to health education, and patient navigation services.
Great. We're so excited to just dive right into this. Tell us about your project. How did you get started?
Well, I'd love to. So this has been really exciting for us at Northeast Valley. We started to screen for social determinants of health around 2017. And our philosophy here, it's really important that we screen our patients for social determinants, but not just collect the data. What our goal is to assess our patients for where they are, what their needs are, but also provide resources, so provide support to our patients. And what that means then is that it's a fairly high-touch process. It's generally one-to-one, either in person, sometimes on the telephone, and sometimes through tablets. But on a one-to-one basis, we're assessing using the Prepare tool for social determinants. And then based on the patient's responses, we use a product called 1Degree to provide digital resources for that patient based on what their needs are. And so, although a great system, it turns out that it is very high touch, and we screen only about 1,200 patients a year. So with a population of 80,000, we really needed to come up with a solution that was a bit lower touch, that we were able to spread both the screening, the assessment of social determinants, but also making sure that we're providing resources to our patients and not just collecting the data.
So, Debra, when you are talking about high touch, are you talking about the staff that are required to support this kind of process?
Yeah, that's a really good question. So exactly. It takes an individual on a one-to-one basis, so a staff person. And we have a variety of staff that do this. We have patient navigators, some health educators through various projects. We have individuals that are trained. And as I said, to do this either in person, always one-on-one, but telephone, in person, or through a tablet. But it is a one-to-one high-touch process. So we assess, and then we provide resources through One Degree.
Great. So it seems that you were trying to solve the problem of screening for social determinants of health, realized that there was a challenge with having too much staff time to put into this process. And so what so far in this evolution of this project has been the highlight of moving this work forward?
Well, there's been a lot of highlights. So we really wanted to come up with a low-touch solution. Ultimately, our goal is to screen all of our patients for social determinants. And again, we have a large number of patients. So how are we going to move from this high-touch approach to a lower-touch approach? And our solution was to work with One Degree, which is our digital platform for social services, and to actually digitize the Prepare tool. So we send it out through a text message to our patients, and they answer it on their phone or tablet or computer. And based on their answers, resources populate from One Degree that are appropriate for that patient. The patient can then choose resources. And the most exciting thing is that all of the data interfaces back into NextGen. I'm pretty excited about that. NextGen is our EHR, of course. But what interfaces back is not only the answers to the Prepare tool, that interfaces to a template in NextGen, but also what resources they chose, interface to a template that we've developed. And so during the visit with the provider or with the navigator following up, we not only know what their social determinants are, but what resources they've chosen so that we can help follow up with that patient.
That's amazing. That's so much rich data to be able to improve care for people and to see are people actually using those resources too is really incredibly helpful. I'm curious about your process of deciding on going with the Prepare tool or One Degree, and how did you land there? Was there a vetting process? How did you figure that out initially?
Well, so a number of things. So the Prepare tool is supported by the National Association of Community Health Centers. And so that is the tool that we started to utilize in 2017. And we did tweak it a little bit, and we're continuing to iterate. So now our EHR NextGen has a supported Prepare tool, which I'm going to just add some important information here, because now what we're able to do is automate the ICD-10 codes, the diagnostic codes that are associated with that social determinant of health. And so when the patient answers or anyone answers that Prepare tool and it interfaces into the template, the corresponding ICD-10 diagnosis populates in the electronic health record automatically. And so that is really, really exciting. And we know that both our health plans and the state of California really want the data on what those diagnoses are in the electronic health record. And it also, of course, then helps the provider in the care team with that patient when they're seeing the patient. So we learned about One Degree a number of years ago, actually through the Center of Care Innovations. And this is a digital tool to identify community resources in the area. And we knew that they had already populated resources in Los Angeles County. We also knew that, they're a nonprofit organization, and their mission really aligned with Northeast Valley. So we were really excited to start to work with them. We've now been working with them for many years, I believe about 5 years. And again, we used One Degree as in that high touch method. We would help assign our patients up with One Degree and help choose resources with them and send those resources either by email, by text, or even the old-fashioned way by printing out a piece of paper. And so this new digital process was really an extension of the work that we already had with 1Degree, and being able to work with 1Degree to send out the prepare assessment through a text message. And the fact that through a low-touch process, they'll still be able to identify resources for themselves is really, I think, a great innovation. And we're really excited about the spread of this work.
That's really exciting, Debra. Not only is it creating like a lower touch on your end at Northeast Valley, but there's been a lot that has been said around how easy it is to send text messages and how patients tend to like to receive text messages. It makes things more simple. One click, right, is like the thing that's been going, the key term that's been going around for all of these kind of technical innovations for patient engagement. Going back to the recommendations that you provide to patients through this process and through these tools, can you give an example of recommendations that are tailored to patients, and are these recommendations based on like zip code, different demographics of the patient? Like how do those details kind of work out?
Thank you. So yes, that's a great question. They are definitely based on the responses the patient provides in the Prepare tool. So for example, if they screen positively for food insecurity, then we have identified, we've actually worked with 1Degree to tag resources that will mitigate or support food insecurity and provide resources to patients. And those would include food pantries, food distribution sites, even educational programs for the individual. And they are in LA County. I would love to say that we do get the zip code from the patient. Sometimes they're a little bit farther out than we would like, and we're continuing to iterate on this process so that the resources are really very close to where that patient lives. And that's really important for accessing those resources.
And can you share an example of how you're using the data on the clinical side for clinical decision making and how that's being implemented into your workflows?
Absolutely. So we use the data in a variety of ways. We use it on the individual basis at point of care, and I'll talk about that in a minute. We also use it on a population level. And so we are able, and in terms of population, we're able to identify all of our patients, for example, who identified as having food insecurity, and then we can reach out to the entire population that identified for that and provide additional resources. We also use it even more globally than that in terms of identifying needs where there are a lack of resources. So either within Northeast Valley, do we need to build up additional resources, or in the community? So we have a number of different levels that we use the data. In terms of the individual level, this is really important, where the provider is now more easily aware that the patient might be experiencing food insecurity, maybe homelessness, maybe difficulty with transportation. So they're referring them to a specialist, but we see that patient has some challenges with transportation. And so that provider and care team are able to connect that patient to resources right there and then to be able to get to that specialty visit. So this is really important at point of care.
Apply now for the COVID-19 Test to Treat Equity Grant Program. In case you haven't heard, the California Department of Public Health has allocated up to $59 million to the COVID-19 Test to Treat Equity Grant Program to improve access to COVID-19 therapeutics in communities disproportionately affected by COVID and with the greatest barriers to care. Please visit T2, as in the number 2, tgrants.org. That's T2tgrants.org for eligibility requirements for California-based organizations, as well as the application link, informational webinars, and additional resources. The deadline to apply is September 30, 2022 at 11:59 p.m. Pacific Standard Time.
Thanks, Debra. And I want to invite Alejandra, if you have anything to add so far that has been exciting about the solution that you are implementing.
Thank you, Jessica. Yes, I would love to highlight that within our EHR, we are able to see the status of the resources that the patient selects. Since they interface over into our EHR, we can see if the patient has marked this resource as utilized, planning to utilize, or if they prefer to no longer utilize this resource. If we see that a patient might have this as a plan to utilize, we're able to see that status, and we're able to assist the patient in getting connected to that resource, since our primary goal is to make sure that our patients are actually utilizing these community resources easily.
Thank you, Alejandra. And so thank you for sharing some of the key results, highlights so far of the project. Could you share with listeners some of the challenges associated with this project and implementation that you've come across so far?
So one of the challenges to make sure, we want to make sure that when we send this text message, our patients are actually completing the Prepare tool and utilizing and choosing resources that are appropriate for them. So we are keeping track. We send out the Prepare to text to the patient. We send out the Prepare tool. And we have a tracking tool to see how long it took for the patient to respond, if they responded, and if they chose resources. So we're really trying to learn as much as we can. And we're trying to figure out, well, what are ways that we can increase the likelihood that our patients will respond to this text message? Our patients really do like text messages. It's the best way we have found to communicate with our patients. But this is, a little bit broader. We're asking them to answer a survey question and a questionnaire through that text message. So not all of our patients are doing that, and we know that. So we're trying to learn ways on what we can do to increase the likelihood that they will respond. And I'm going to pass it over to Alejandra to share some of the interventions that we're using to increase that likelihood and have more patients respond digitally.
Thank you, Debbie. So as we mentioned, we are tracking when we send out the digital Prepare tool. We wait about 2 or 3 days to allow the patient enough time to answer this independently. And if we notice that they have not completed the Prepare assessment, we go ahead and give the patient a call, see if they needed any assistance completing the tool. And if they say yes, we can answer the questions one-on-one while having the patient on the phone through OneDegree. And those responses will go ahead then and interface back into our EHR.
We are also trying various interventions to, again, increase the likelihood that patients will respond digitally. So a couple of things that we're doing is, number one, we're wanting to test on a different population. So far, it's still been our high-risk population, and we're really looking to test it on maybe a younger population and seeing if they're more likely to answer the Prepare tool, respond to the Prepare tool individually in a low-touch manner. So that's one of the ideas that we have. In addition to that, we are considering things like sending a text message even before they receive the Prepare text message. That way, knowing it's coming from Northeast Valley, that this is something important for you to answer, that we hope that you do. And then also, if they don't respond, a text message afterwards asking if they need any additional assistance. So those are our ideas that we're going to be implementing to see if we can increase the numbers.
Thank you for sharing about some of the challenges that you're facing and what you're doing to try and overcome those challenges. This also leads me to think about the initiatives that are happening at the state level in California, and really this need for payers to get SDOH data. And I'm just wondering, from your perspective at Northeast Valley and what you're doing with OneDegree and the Prepare tool, how do you feel like this supports your capacity to meet the payer's data needs?
Once the patient answers the Prepare tool, once again, the SDOH ICD-10 codes, those are the diagnostic codes, are documented in our electronic health record. Now, what's interesting is that since this is done digitally, there's no one then to send that encounter. And I will say that once the patient answers the Prepare tool digitally, it creates an encounter in NextGen. So you can see on our history toolbar that the patient actually answered that questionnaire. But it will sit there because then nobody is forwarding that to our health plans and therefore the state. And so as a part of this work, which we're almost ready to implement, we have now know the need to add a CPT code. So that's a procedure code to submit it to our health plans and therefore the state. So not only is it going to be automatically placed into the medical record for clinical use at point of care, the data will be submitted automatically to the health plans in the state for use that they also want. They want to know, of course, what social determinants are affecting our patients at Northeast Valley and throughout the state, because they're looking at this broader picture of risk stratification around social determinants of health, which at Northeast Valley, we're doing a lot of work around, in that we are actually assigning risk tiers to the prepared tool. So we are, once they answer those questions, they will be assigned a score and then a risk tier, and then we can stratify those patients and provide them with the support they need. Again, once the higher risk patients get high touch support, the lower risk patients, lower touch support.
So, Debra, you're just solving all of our problems at Northeast Valley, right?
One step at a time. I tell you, it's really a journey. It is, we have lots of visions, lots of plans, lots of dreams, but it takes persistence because these changes do not happen overnight. They take a lot of work and a lot of people and a lot of steps to make it happen. But we're really excited about the journey.
I'm curious, you've done amazing work, and I would love if you could share with, listeners, like, what resources have you been using and engaging with to help you think through this process, to help move this work forward? Any resources that you can think of that others can tap into to do work as innovative as you are at Northeast Valley?
Well, thank you, Jessica. I will say that we learn from others. It was over 5 years ago where we heard from another health center about a high touch and a low touch approach to social determinants. And, with that, it was like a light bulb. Well, we know that we need various approaches to accomplish what we want to, which really is universal screening of social determinants. So we have, again, as I shared, a high touch approach. We have to figure out what we can do to spread that in a low touch approach. So I learned that from another health center. And of course, we take what we learn and we apply it here at Northeast Valley. So we had that vision, and then, working with our vendors, 1 Degree, and we have an amazing IT staff here at Northeast Valley that have been really involved from day one and really support this work. But really sharing our vision with them and working together with this team to figure out, well, what are the next steps to make it happen? And that's where that year work that we mentioned, so just that technical piece, has been within the last year.
Is there any last advice you would give for other organizations that are looking to implement similar screening and integration, community resource tools, and closing the loop as you all have created that process? Any roadblocks that you feel like, hey, think about this in advance before you engage in this work?
There are always roadblocks. I think that, again, persistence is really the key. I will share that it took us a number of years to identify funds to do this. We didn't give up, and not everybody, it didn't fit the vision of everyone that we looked to fund, and we finally identified resources, and we're really excited about that. And I think that if this is a vision of your organization, you need to keep at it and find those resources that will help you implement these new ideas, new innovations. I will also say that, the technical pieces are never easy. The vision is kind of easy, but making it work is not always so easy. So identifying the right partners. We did have to add on a third partner to work and implement the interface, which is working quite well, but that wasn't so easy initially. And so that's something that we had to find additional resources. So I think working with a team that really shares the vision and persistence and finding those resources to make sure that your project is funded and continues for sustainability.
Thanks, Debra. So as we close here, I'd love to hear what's next for this project and innovation work. What are you really excited about?
We're really excited about the next steps here. I already shared that we're able to send that text message out to an individual patient, which is great. But what we really want to do is expand that to a group of patients or a population of patients. So we have the opportunity to send it out to, for example, all diabetic patients who are coming in the next couple of days, or send it out to patients who are coming in with their young children, maybe 0 to 3 for their well child exam in the next couple of days. And with that, we can send it to a group of patients all at once, get those results in for social determinants, and then the provider will be able to see that data at their visit. And so that's our next goal, is to identify those groups of patients that we want to reach out to.
Great. That's really exciting. And I look forward to hearing how that goes. And you're a Tech Hub member, and so we'll continue to keep in touch and hear what's going on with that project. I want to thank you so much, Debra and Alejandra, for joining us, sharing your experience and expertise. You are valued members of this learning community. So thank you very much.
And thank you so much for having us. It's really fun to share all of our work, all of our innovations, and we look forward to the next time.
Yes, thank you so much for having us.
Thank you for tuning into this episode of Health Pilots, hosted by the Center for Care Innovations. If you like what you heard, please spread the word and be sure to subscribe on Spotify, Apple, or where you listen to podcasts. For more information about the Center for Care Innovations or for upcoming program and funding opportunities, please visit our website, careinnovations.org, and follow us on Twitter @CCI Voice. We'll catch you on the next episode here on Health Pilots.